Right now, we're kind of MacGyvering patient care.
We are the only resource really for people in our community and area.
You call San Antonio and Austin, and they're number 80 something on a list for an ICU bed.
We may have gotten a break from high COVID-19 case counts and hospitalizations earlier this year, but ICU beds are filling up again, partly fueled by the more contagious Delta variant. Exact ICU bed availability can vary hour by hour and day by day, but the Southwest Texas Regional Advisory Council, or STRAC, says that they're seeing some ICUs full or near capacity at any given time. In this episode of Commerce Street, a business podcast from KENS 5, we're hearing from a type of business that reveals even more effects of rising COVID numbers. Freestanding emergency rooms operate on their own, separate from hospitals. They're different from urgent cares, focusing only on emergency needs, and often serve in locations that don't have full hospitals. They may accept different forms of insurance or have different costs, but they offer similar care to hospital ERs and can transfer patients to hospitals for longer-term care. To understand how they've been impacted and what it says for all of us, first we need some context on the lack of ICU beds. We've seen surging case numbers before, but in some ways, the strain on hospital systems and ERs is even worse now. We spoke with Dr. Ralph Riviello, University Hospital's Chair of Emergency Medicine, who explained a key difference this wave.
Right now, as compared to a few weeks ago, how busy are your ERs looking?
So our ED has been pretty busy for the last few weeks. We're usually now seeing about 30 to 40 patients more per day than we had been traditionally.
How did that compare to during the last big spike of COVID, or, just maybe what we would see, what we saw a few months ago?
Sure. So it's definitely more than what we saw a few months ago, and even more than what we saw in the last surges.
Is that just because there is a big surge of Delta cases, or are people coming for other things now that they wouldn't have come for before? What are you kind of seeing?
It's actually a little bit of both. So we are seeing a number of patients with COVID-related complaints and problems, but also we're seeing people who are coming for the normal things that people come to an emergency room for. In the last surges, those people tended to stay away. They were going elsewhere for care or delaying care, but now they're coming in just as much as they would on, when we didn't have COVID surges. So I think that combination is really what's strapping our emergency departments.
When should I visit the ER for something versus when I shouldn't? Are people also showing up for things that maybe I could just call my doctor for?
So we occasionally see that people who probably would be better served at a walk-in clinic or their primary care doctor. But I have to say, when we've looked at our data, a lot of the people that we're seeing need to be here. But things you should definitely see your doctor for are minor injuries, work notes, just a simple COVID test. So if you think you might have COVID, but you're not having, severe trouble breathing or severe chest pain or that, you probably should go to your family doctor. Mild abdominal pain, urinary symptoms, mild allergic reactions, all of those could be handled in any of the walk-in clinics across the city.
That's where freestanding ERs come in. Dr. Jeremy Gabrish, a board-certified emergency room physician, leads the emergency clinic in Livonia, filling the area's need for emergency care.
So just kind of talk to me about, over the past few weeks, what kind of patient volume have you seen as compared to what you would normally see in the middle of the summer?
Yeah, we have seen a huge increase in just the daily volume of patients from what we were seeing before the summer. And then relative to previous summers, an astronomical increase in what, would typically be normal emergency room volume for the summer.
Are there a lot of other emergency rooms in your area? And so where do you get patients from?
We are the only emergency facility in our community and the surrounding area. We are a freestanding emergency center, so we're not attached to a hospital, and yet we are the only resource really for people in our community and area. What that means is that we end up seeing tons of urgent and sick emergency patients, especially during this time right now, both patients with COVID and other non-COVID related emergencies.
Dr. Gerardo Ortiz is Chief Medical Officer and Director for the Lone Star 24-hour ER in New Braunfels. He says his facility is also seeing high volume.
It's hard. You have sick, you have not sick. The freestanding emergency rooms, nobody wants to go to the emergency room. And so we try to make it as pleasant as possible. I've been in emergency medicine for 18 years now, and we try to make the experience as pleasant as possible. It definitely adds challenges when you're seeing that kind of volume. And the other thing that's interesting is you start a shift in the recommendations from the beginning of the shift to the end of the shift, from the CDC, from all the health councils, from the American College of American Physicians, even it changes. So it's so dynamic that in 6 hours, the recommendations have changed, and then you've got patients lining up. So it's definitely been a challenge to see, especially with staffing too, trying to keep the staff be adequately staffed, not overstaffed, not understaffed, and not knowing when the volume is going to change. It's just overnight.
What types of things do you typically serve or help with at your freestanding ER?
So we take care of just about anything that a traditional hospital-based ER takes care of. We take care of stomach issues, heart attacks, strokes, car accidents, broken bones, stitches. We take care of everything. So we're still, the challenge with this go around versus last spring is that now that the state is open, we're having all the typical ER emergencies on top, and then we have COVID on top of that. And so that's where the challenge has been, trying to serve everyone and then trying to isolate COVID to one side of the ER so that we're not having the non-infected people with the infected people, trying to keep staff safe, trying to keep the community going. Those have been the challenges that we've been dealing with.
Most of the patients we're seeing right now are COVID related, but actually that raises a concern. As emergency doctors, we are worried that patients are delaying care or avoiding care for things like heart attack and stroke, surgical emergencies like appendicitis, the things that we usually see. We really want to encourage patients not to avoid coming to the emergency room for those types of conditions. And we also want to, really encourage our hospitals to seek solutions to keep beds available for those types of patients, because we have patients coming in with, emergent and urgent conditions who still need to be hospitalized for these non-COVID related issues. And so we need to make sure that we have the capacity to take care of those people as well.
So we've had first responders, we've had EMS reach out to us about potentially dropping off patients that are not as critical. So we've been approached about that. We have had to hold. So typically, if you have a patient in a freestanding emergency room that stays over 24 hours, you have to report it to the state. We've had ICU patients that have stayed over 60 hours with us because you call San Antonio and Austin and they're number 80 something on a list for an ICU bed. We've had COVID patients on oxygen that have been with us for up to 20 hours. Those have been the challenges. And then on top of it, it's really difficult when you have these challenges with the hospital system. And after you've done emergency medicine for a while, you can see when someone's walking in the door. Sometimes you can anticipate this person's going to need to be admitted, and the challenge, the hurdle that's going to occur with getting that patient in bed. So sometimes we'll even talk to the patient and say, listen, I think you might have appendicitis and we're going to need to talk to the hospital, but they would rather stay with us for a prolonged period of time because they know that they're going to get the care and the attention that they need, and they're happy to wait with us until a bed pops up. But sometimes it's a couple days.
And I would imagine, even though you are seeing more patients from time to time, you still have room, right? Like if people need help, you would say,
Absolutely.
Go ahead and come and we'll try to help you guys out pretty quickly.
Absolutely. We're there for the community. I can't imagine a scenario where we'll say we can't take any more patients. We're open. We will make the room. We will find the staff. Our staff is so committed. We have people coming in on their days off just to check in and see, hey, do you need an extra hand? I've got 3 hours. What can I do for you? We have administrators that are coming in and cleaning rooms, doing whatever it takes to keep the facility moving. So absolutely, we have plenty of room at our facility, and we are there for the community for anything COVID related, non-COVID related. We're always there.
Yeah, we would always encourage people to seek care if they, have an emergency condition. We, we are handling the increase in volume quite well, I would say. The one thing that we would like to see solved is increasing availability of beds so that, when patients do require a higher level of care, we can get them transferred on out and get an ICU bed for them. That's an area where we really need to work on, because anecdotally we've had patients, like I said, that should be transferred out in a matter of hours, but have sat with us on oxygen or more advanced measures for days while we wait on ICU beds.
Is there anything else that you think is important for people to know, or anything else big that you've noticed over the past few weeks or months that this surge has kind of created?
Yeah, I think obviously the importance of vaccinating is our best chance at getting through this. I think the other thing that people, I think the biggest thing that people need to know is people just don't know where to go. People just don't know what to do. Freestanding emergency rooms, we are there for the community. And if anybody has questions, call us. You don't necessarily even have to drop in. You can call, you can talk to us. We've taken care of patients who have needed oxygen, but there are no beds at the hospital. So I've sent them home and had them FaceTime me 2 hours later just to check in on them and see how they're doing. Right now, we're kind of MacGyvering patient care, but we're wanting to take care of as many patients properly as possible. And so if it means I need to FaceTime you every 2 or 3 hours to make sure you're doing okay, then I'll FaceTime you every 2 or 3 hours to make sure you're doing okay. And so don't hesitate to reach out and seek the help that you need when you need it before it's too late.
We hope you enjoyed this episode of Commerce Street, a business podcast from KENS 5. To hear more episodes like this one, subscribe on Apple Podcasts, Google Podcasts, Spotify, or head to our website, kens5.com/Commerce Street. I'm Erica Zucco with producer Kristen Dean. Thanks for listening.